Hi, welcome everyone. Thank you for coming in today. We have a great set of alumni panelists here, and they're here to share their experience and answer your questions on the topic of public health. And as we go through this presentation, please feel free to type in your questions in the chat or just use the raise hand feature to ask your questions. And so we'll first get started by asking each of the alumni to give us a brief introduction and an overview about their career path and their current role. And then we'll open it up for questions from the students. So Amy, would you like to start? And then Hannah?
Hi, everyone. I'm Amy Drolet. I was an undergrad at UW-Madison a long time ago. And I was just talking to Vinya how I started off in this College of Ag and Life Sciences and then ended up over in LNS, where my bachelor's degree, I majored in zoology and conservation biology. And then I managed a research lab on UW's campus for 8 or 9 years or so before deciding it was time to go back to school. So then I did a master's in the School of Ed in counseling psychology, and then bounced around a little bit, ended up at the State Public Defender's Office doing sentencing and mitigation work in criminal justice. It was really fascinating. And I'm currently doing more public health. Well, it's public health. I'm with the Department of Health Sciences, or I'm sorry, Health Services right now. I've been there just about a year. And my role is in mental health law. So I am a client rights specialist. So patients at any of the state mental health institutions or state centers can file complaints about their rights being violated. And it's a multi-level, multi-stage process, and I'm stage 3. So if the complaint's raised to stage 3, then I'm one of the investigators who investigates whether or not there's been a rights violation and issues a decision. So a lot of legal writing and a lot of mental health law, and I just love my job. So happy to be here and talk about my unconventional track to getting into public health.
Thanks, Amy. Hannah, would you like to introduce yourself?
Sure. So I graduated from UW-Madison in 2010, and I had my degree in psychology in undergrad. And then I went on to get my master's degree in biological psychology, also at University of Wisconsin-Madison. I was looking at the genetic underpinnings of schizophrenia by doing genetic knockdown in rats, and then looking at behavior in those rats compared to controls later on in life. And then I realized that I really wanted to have more of a direct impact on people's lives, and the rodent work and doing future academia was just not going to cut it for me. So I switched gears and entered into a master's program for genetic counseling, and loved that. And I've been a genetic counselor now for 6.5 years, and I've been working at Invitae, which is a genetic testing laboratory, a diagnostic genetic testing laboratory based out of San Francisco. And I specialize in neurodegenerative genetics. So I'm doing assay development for new genetic testing offerings. I'm working on variant interpretation and developing report text that actually shows up on the report that patients receive. And I'm advocating for patients and clinicians to make this language really clear and easy to understand for individuals who don't come from a genetics background, which is the vast majority of us. And also advocating for better access to genetic testing for individuals of all backgrounds and all socioeconomic statuses, and ensuring that there's access, there's education, so that individuals can really have as much information regarding their genetics as possible to make important medical decisions later on in their life. And so this is also, like, I wouldn't call it a standard track for public health, but I think that it is a really important aspect of public health, especially as genetic testing becomes more mainstream. And there are so many different avenues to explore your genetic information, your genetic background. And there's also a lot of negative stigma surrounding genetics in general. So working to remove some of that negative stigma and increase awareness and information regarding the benefits of understanding your genetics is something that I'm very passionate about.
Thank you, Hannah. Now that we've heard from the alumni, we're going to open this up for student questions. So students, if you have questions, again, feel free to use the raise hand feature or use the chat, and then I can read it out to the alumni. So yeah, we're going to just open it up to the students. So Hannah and Amy, what advice would you have to students who want to go into this field, and what should students be doing to prepare themselves to be successful in this field?
It's a great question. I feel like it really, of course, I think number one is kind of looking into, like, within public health, what interests you the most about that field, because it's such a giant field. It encompasses so much that your success is really going to depend on like what path you decide to go down. Although I will say that I think that scares a lot of people when they're in college. It definitely scared me. I remember my parents telling me, like, you have to have this figured out when you're like a sophomore or junior in college. And that is terrifying because we're all growing and changing over time. And no one has everything figured out in college. So I think even if you're like, oh, I'm really interested in genetic counseling, or I'm really interested in mental health and advocating for individuals with mental illness, like, even if you start down that path and you realize in graduate school, or you realize 2 or 3 years into a career that you're not, it's no longer your interest, something else is piquing your interest, there's always room to pivot and go in a different direction. It really, I think, depends on your personal interests and listening to yourself instead of, pressure from other people regarding what type of field you should go into. Specifically for genetic counseling, because that's all that I know. Getting some experience doing shadowing work with local genetic counselors. There might be opportunities to do this virtually depending on the clinic. Like at University of Wisconsin might have opportunities to do virtual shadowing just in the world that we live in with COVID. There are also virtual shadowing opportunities outside of like clinical settings. So in a laboratory setting, I know that Invitae, for example, has externship opportunities for individuals who are interested in genetic counseling and want to learn more about how they could pursue a career in genetic counseling if they ended up wanting to go into industry, like working for a genetic testing company. So exploring those options and just getting as much experience as you can, because again, it's not only that experience that will look great on a CV when you're applying to graduate programs, but for all of you internally, it will help you figure out, like, does this truly interest you, or did it sound good on paper? It sounded good when someone else was talking about it, but then when you learn more about it, you're like, oh, this actually isn't really up my alley. So just getting as much experience as possible is my number one recommendation.
Yeah, and kind of parroting what Hannah said, the field of public health is so broad that I would encourage everyone to really think about all the different type of skill sets that are needed. Like, public health doesn't just need everybody with a master's in public health. They need accountants, they need sociologists, they need people who understand health disparities and oppression and racism. We need people who know a lot about the law. Like, my area is really, all I do is interpret statute and administrative code all day, and that wasn't what I ever saw myself doing, let alone enjoying. But public health is such a broad field that you can end up here because it's where you ultimately want to be from when you were in college, or you can end up here later on in your career. And I'm guessing that something that you've done, whether during your undergraduate days or in some other job you have, would probably be a valuable experience in public health, because it's so broad, from, like I said, the financial part to the social part to policy. Policy is a huge amount of what's happening in public health right now. Or nursing, CNAs, like all these other skills that you might pick up along the way could be really helpful down the road, or you might not even know about it. And also, like Hannah said, investigating what element of public health might interest you, because maybe what you're really interested in is doing on the ground work in some sort of underserved area, or maybe what you're really interested in is policy. And so with such a broad range of job duties in the field, it would be good to know which part of it for global health. Like maybe you want to go do public health in a third world nation. We're not supposed to use third world anymore. We're underdeveloped, under-resourced area of the world. So yeah, just kind of do a lot of research and talk to people. Like, I mean, I know that SuccessWorks pairs a lot of students with former UW students, and I love talking to students about what I did or what I wish I would have done. So yeah, take advantage of those resources.
Thank you for answering that. Our next question is, what are some skills that you gained at UW-Madison that have helped you over your careers?
Scientific thinking and understanding how to think like a scientist. I'm not doing research now, but all those years of doing research as an undergrad or managing a research lab have helped me understand a lot of related but kind of tangentially related things in public health. So like Hannah, I did my research in the psychology department too, on non-human primates and pair bonding and how they raise their offspring. But being able to digest the original research coming out has helped me understand, I don't know, law is a little bit different, but understand research in all sorts of other areas. Like when I was in criminal justice, toxicology and substances and brain development. So I think the number one skill I picked up at UW is how to think like a scientist, understand research. You might not have the opportunity to do it on your own, but to really kind of get into the guts of a study and understand what are the key points, how to use those key points to pick apart what you might read in the news or hear on, the media outlets that isn't telling you the whole story, but because you know how to read a research project or understand research, that you might have different takeaways.
Yeah, I completely agree, Amy. Scientific thinking, critical thinking, those were amazing skills that I also learned during my undergraduate and grad school career at University of Wisconsin. I think outside of what I learned in terms of critical thinking and outside of what I learned directly from my coursework, I will just say that the opportunities that I had and that I took on while I was at UW really helped hone in on my more interpersonal skills of empathy and compassion. I worked for a nonprofit for 6 years during the time that I spent in Madison, called Options in Community Living. And I think it still exists because I actually saw it last time I was home. And this nonprofit pairs, undergrad individuals or grad school, people who are looking for a part-time job, as well as full-time social workers, pairs them with individuals with various types of mental illness in the community, and helps them integrate these individuals, many of whom came from more long-term mental health facilities or hospitals, into the community. So they're living in group homes or they're living by themselves, and help them develop social skills, and not be afraid to walk to the grocery store or have conversations with people that they don't routinely talk to, things like that. And I found that so rewarding. And I know that's not like it wasn't part of my coursework. I didn't get credits for it, but it was definitely one of the most rewarding experiences of my life to work with people who I had never had the chance to directly work with. Even though I was working in a schizophrenia lab and doing all this research, I had never actually worked or hung out with, spent time with people who have schizophrenia. And so that really meant the world to me. And I think I would definitely recommend individuals who are looking to go into public health in some way, if you do want to have that direct contact with individuals who are underrepresented, or they're individuals who have been negatively impacted by public policy historically, like working directly with those individuals and raising their voices, like, what aren't you getting? What can we do to make your life better? Like, what are we not doing well? Can make such a big difference and bring out that compassion, empathetic side of people.
Thank you for answering that. Our next question is, how did you get started in this field, or where did you start looking for a job in your field?
Well, so I work for the state of Wisconsin. So I would guess that, whichever state you might end up in at when your undergrad career is done, whether you stay in Wisconsin or you go to a different state from which you came, state government is a great place for state or county or local governments are a good place to start looking for jobs. And so I know that in my agency, the Department of Health Services, like once you get your foot in the door, there's a lot of different movement once you're into an organization too. So that would be something that, say that you might be interested in public health, and like the key position that you think you might want to have someday isn't open, but getting into an organization that does public health work and getting to know people and getting involved in committees, or introducing yourself to folks who do the type of work would probably be one way you could get in. Yeah, let me think on that, Hannah, if you have something to add. How you're in a specific field, but
Yeah, but I mean, I think that's a great recommendation. Also, like hospitals, which tend to be affiliated with universities, which, like UW, that's, I think that would be a good place to start, because it's such a huge organization, so many opportunities. Outside of that, I mean, for genetic
I wonder about
counseling,
nonprofits too. Would
yeah,
nonprofits be like you worked for a nonprofit that helped
yeah,
individuals with chronic mental health issues.
yeah. Again, I mean, I haven't been in touch with my previous colleagues from Options for Community Living in years, but I'll give a huge plug to them if anyone's looking for like a summer job this next summer. Again, very rewarding experience, and I'm sure there are a lot of other nonprofits just as like a starting point. Unfortunately, they don't tend to pay that well, even if you do have your social work degree. So just keep that in mind. But a great undergraduate or grad school side job for sure. When I graduated with my genetic counseling degree, honestly, I applied to 20 different jobs. I wanted to apply to a range of clinical positions at a range of different hospital types. So I applied to like the Kaiser system, I applied to Stanford, I applied to UCSF, because I did my grad degree at UCSF in San Francisco. So I applied to a lot of different places, and then diagnostic genetic testing laboratories as well. And I just wanted to see like what was going to, where everything was going to land, how interviews would go, where I was most interested, or who I was most interested in after getting experience interviewing. So I would just say, I mean, if you have the ability and you're really excited, but you're not sure like what avenue you want to go down, that's something else you could do. Just look at all of the different options and apply to a lot of different places, and just be honest with the people that you interview with that you are applying to many different places, and still, looking to explore your different options. But yeah.
Great, thank you so much. Yeah, Mike just asked a question in the chat for students to share their majors and their years. So maybe we can get questions that are more tailored to the years that students are in. But yeah, students, feel free to put in your major or your year or both in the chat. But there's another question that's come in. What skills or experiences will I need to develop to make myself more competitive for a mental health career?
I'll echo what I said earlier. Compassion and empathy are key. Truly, like, seeing individuals who may not come from the same background as you and don't have the same like privileges that we're afforded to, like, all of us in different ways, and really like understanding and recognizing how that can affect people's lives and how that contributes to mental health. And just truly like having that internal drive that you want to make a difference, you want to help people. I think that goes so far and isn't necessarily like always something that you can learn by taking a million courses, but something that you really learn from real life experience. And just, I think more broadly, just there's that internal drive for the compassion, empathy, but like drive in general, I think goes a long way. Like, you're not going to give up when your career gets tough. Working with people with mental health issues can be really hard depending on like what avenue you go down in that field. So knowing that there are going to be like bad days, or there are going to be days that you feel like, I've failed. I feel like I'm not making a difference. Just knowing like that you can look to the big picture, like you are making a difference. It's so important for people to go into these fields that truly care about other individuals, and then it kind of has like a chain reaction on helping other individuals like tap into their empathy and compassion for others. So I think just having that drive to keep going, not giving up, and knowing that this is definitely like a tough career path, but so rewarding, to know that you're like making a difference, helping people.
And I would echo what you said, Hannah, that empathy, and the desire to help people, who want to help people, goes a long way. I would add some experiences on the ground working in mental health situations look great on a resume. When I was looking for interns or helping hire at the state public defender, my position there was I wrote sentencing memos and took care of mental health situations with clients that in our office. And I hired a number of similar staff, or helped hire a number of similar staff. We'd always look for folks that had experience working with individuals who might have mental health issues or substance abuse, developmental disabilities, that goes a long way. The experience goes a long way. And similar to public health, mental health is really broad too, right? So there are the business end of it, the direct, if you want to be a counselor or a therapist, there's that end of it. But then there are policy, there's law, it's really broad as well. So I did like a clinical, this sunlight's really bad here. I did a clinical master's degree where I could have gone on and become a licensed practicing counselor, an LPC, but I just wasn't interested in the same way by the time I got done with my master's degree. So I continued in the field, just doing more like advocacy and criminal justice end of mental health, and I'm now doing more law and policy. So the skills will be helpful, like learning about mental health and learning about diagnoses and systems are going to be really helpful no matter how you end up, being in the field and how long you end up being in the field. They're helpful skills. Like, they help me as a parent, as a partner, as a coworker. Like, they'll help your personal life too. I'm almost guaranteeing any skills you learn in the training to work with people in mental health.
Thank you. Looks like we have students from pretty much all over the board here. Global health and neurobiology, international studies, psychology. So definitely a huge variety of majors. Another question is, what trends have you noticed in your career in public health, or where do you see opportunities or changes in the future, just in regard to maybe COVID and climate health and things like that, climate change and things like that?
Sure. I can't really speak to climate change in terms of my personal career path. Could go off on a tangent separately, but I'll hold off on that. Um, in terms of like genetics, and I can touch on COVID as well as part of that, or kind of tangentially related. I think there are a lot of gaps currently that need to be addressed by individuals who focus on public health and specifically public policy. So there is this act that was passed, I believe, in like 2008, called the Genetics Non-Discrimination Act, or I think the acronym is like GINA. And so essentially, you can't use someone who has an actual like disease-causing mutation. You can't use that as a pre-existing condition to prevent someone from getting insurance coverage, which is amazing. That was a really, really important law that was passed. Of course, laws can also be like taken back, and so it's still like, it can be scary knowing that like it's not set in stone forever, potentially. So always something to keep in mind. But right now we have that in place, which is great. But individuals who have a family history of certain types of genetic conditions and have either not had genetic testing, or who also test positive for a genetic condition like Huntington's disease is a great example of this. So if, say that I'm unaffected, I'm 33 years old, but my dad had Huntington's disease, just that very fact, if I include that on my medical records, means that insurance companies can refuse to provide me life insurance, and they can refuse to provide me long-term disability insurance. Even if I haven't had genetic testing myself, and I don't know if I am a carrier of the Huntington's mutation and will go on to develop Huntington's myself. And that is horrible for so many reasons, especially because individuals with Huntington's require so much long-term care that it's just, it blows my mind that they're not able to get that care unless they are, have these pre-existing privileges in terms of socioeconomic status, help from family members, et cetera, et cetera. So I think that's like a huge avenue in genetics that requires a lot of public health assistance and individuals who are really interested in that type of public policy to go like onto Capitol Hill and be working with politicians to make these laws better and encompass things like long-term disability and life insurance, and prevent insurance carriers from discriminating against individuals who have genetic conditions that we cannot help. They are genetic. Rolling that into COVID, I think how COVID, I mean, there are so many differences when you look at the data in terms of the individuals that are disproportionately affected with COVID and disproportionately affected with severe forms of COVID. And of course, African Americans, other people of color are disproportionately affected. They don't have access to the same types of treatment as individuals who are white. People in rural areas aren't getting access to the same type of treatment or information or education regarding COVID. With vaccinations, there is a fear that I would say, like, it makes sense that there is this fear among people of color compared to certain, white people, except I think it's like also socioeconomic status as well and education level. But people of color have a historical fear of medical professionals and not wanting to get vaccinated or seeking treatment for things like COVID, because historically the medical profession has treated people of color and African Americans really poorly in the past. Like if you think of the Tuskegee experiments that happened there and just forced sterilizations and in the past, things like that were happening preferentially to people of color or people with severe mental illness as well. So I think there are a lot of issues there that public policy could, and public health in general, could really help to tackle. And I think those are issues that individuals in different areas of public health are attempting to tackle right now. Like, where are we seeing these disparities? Where do these disparities come from? It's not like, oh, this group of people, they're not doing it. Like there must be something wrong with them. No, we have to look backward. We have to look at history, and then we see, there are great reasons why certain groups of people are more hesitant to get the vaccine compared to others. And then looking like at how we can change this trajectory moving forward. How can we increase trust in medical officials? What can we change in terms of public health to ensure that there's more equality in terms of how different groups of people are being treated, things like that.
Yeah, Hannah, like that you're touching on health equity. I think the trends that I see are, thank goodness, it's about time a focus on health equity and inequities that have existed, in our systems forever. Another trend I see that's kind of related to health equity is policy. Policy is becoming more and more important. My day-to-day job right now, interpreting policies at state mental hospitals or administrative code, which is another way of saying policy, or our Wisconsin statute policy, is that sometimes policy is really poorly written. Right. So a focus on policy is great because hopefully we're going to have updated statutes and codes and policies that really take a broader view of what issues we're trying to, rein in with creation of policy or help with creation of policy. And then the third trend that I have seen is, it seemed like mental health used to be siloed from physical health, right? So we had like medical was separate from mental health. And in my experience, I've seen like emerging, which I think is a good thing as well, right? If we think about our body, it's not as if my mental health is somehow separate from my physical health, like they're deeply entwined. And so the fields of health are becoming more holistic, I'd say. So those are the trends that I've seen personally.
Great, thank you both for answering that. Students, again, if you have questions, then feel free to just raise your hand or put it in the chat. But we do have another question. What are some things that you wish you would have known at graduation that would have been valuable in your career?
I think just knowing that everything is going to work out the way that it should, that it's not worth having so much anxiety or so much like, I need a step-by-step plan for this year and then 5 years from now and then 10 years from now, and I need to stick to that plan. And if anything goes wrong, it's horrible. I wish that I could have told myself at graduation, it's okay. Things aren't going to go according to plan. I thought I was going to get my PhD in biological psychology, and turned out I did not want to do that. I did not want to work with rodents. I didn't want to go into academia and deal with some of the things that you have to deal with in that line of work. And it was okay. And it was actually more than okay, because I love the career that I'm in, and I didn't know that career existed until I was in graduate school. So I think just, I know, again, this is more of like a life skill, but and hindsight's always 2020, but really just telling yourself like it's okay if you change directions and things don't work out the way that you thought they would a few years ago, or in your current moment right now, you might end up on a completely different trajectory, and that's fine and that's normal. I think it happens to like 80% of individuals who are in college or around that age.
Yeah, similarly, Hannah. Yeah, I had all mapped out and nothing has turned out that way. And thank goodness, because I'm exactly where I think I should be probably. And, whatever path I took here was, it was meant to be. But I spent a year advising on campus not too long ago. And I know you are all like, we're all high achieving, driven. Yeah, and I think sort of relaxing and leaning into like this is going to work out, like some of the skills that I picked up here might not seem directly relevant, but it's probably going to work out because I gained some life skills too that are going to come in handy. And then the other thing that I think about is how when I was an undergraduate, it was like science, chemistry, biochem, all these hard science classes, and like the soft science, like psychology. I did take the primate classes, but like all the psychology and sociology, I was like, oh no, I'm not into that at all. But the older I get, my goodness, I wish I would have taken like a philosophy class. I love philosophy now, but when I was, 18 to 22, like, are you kidding me? That was a dirty word. I wasn't going to take those social science classes. So whatever it is that you are majoring in, I would encourage you to take some classes that are like on the other side. Like, I mean, I don't want you to take calculus if it's like, something that's just going to hurt your GPA, but like take something outside your comfort zone or outside your field, because those are the types of things that I wish I would have known about, how they're going to come in handy in ways that you can't really conceptualize when you're in it, in the thick of it.
Thank you for answering that. Another question is, what have been your considerations when choosing a job or applying to a job or interviewing with someone?
What was the beginning part of the question? What were our considerations?
Uh-huh.
Gosh. When I was applying for jobs, I mean, this isn't, I guess like money did matter after going to a graduate program that I had to pay for. At the end of the day, that was something that factored in for me. I needed to be able to make a living wage living in the Bay Area, which is tough. So that was just one part of it, unfortunately. But outside of that, I looked at like the questions that I would ask the individuals who interviewed me were like, what is your day-to-day, what are your day-to-day responsibilities? What is your work-life balance like? Again, this will vary drastically depending on what type of public health related career you go into. But in genetic counseling, I can say that there are some positions where you're working 8 hours a day. It's very like standard 40-hour work week. And then there are a lot of positions where you are working up to 12 hours a day because you are doing the work of like 2 or 3 people, and you're working for a startup, or you're working for an academic institution where you're really going above and beyond and doing a lot of research and also clinical work, working with patients and families, and you're preparing for different sessions. And so just really understanding up front what the expected and the average like work week is, I think can be really helpful in order to attempt to avoid burnout, or just understanding like what you as a human are looking for in your career and your work-life balance. I think those are really important general questions and considerations to take into account when looking at different career options.
Yeah, I have a mix of boring, like adult things, like I need health insurance for my whole family. So like there's probably some really great startup things that I would be cool jobs, but I'm not gonna be able to take yeah, boring things like health insurance and retirement and yeah, you need to make a living wage. But then yeah, the work-life balance is really important to me and sort of the culture of the office or the setting that you're gonna work in, because you're gonna end up spending a lot of time with these people. I mean, lately it's been a lot of time on Zoom when we're working remotely or hybrid, but you're going to end up spending a lot of time with these people. And so if it's people who, if it's a setting where, your humor is not going to be welcome, or it's just sort of I wouldn't do well in a sales situation probably, like, so you have to take into account the setting that you're going to be working in. And then also, and you might not realize this until you've had a few jobs or a few work experiences, but sort of like, is this something that's going to make me feel good? Well, I need this. I don't know if everyone needs this, but I need a job where I feel like good about my job and good about what I'm doing at the end of the day. So does its mission kind of align with my personal mission? Because I wish I could just say I could take a job that pays me really well, but would just create a lot of plastic or something like that. But those are my considerations. But I think with COVID, I mean, we were talking about this before the meeting started, like COVID has created flexibility in lots of positions where there wasn't typically flexibility. Like my state job was like my 9 to 5 in the office, 30-minute lunch break. And now I work remotely 3 days a week and no one really knows what the heck I'm doing other than I'm getting work done, right? So I think, thank you, COVID, unfortunately, for creating flexibility in a lot of workspaces where it just had never been considered before. So
Yeah, I want to add one more thing. I think those are great points, Amy. Definitely, I feel the same way about like wanting a job where I do feel that like internal sense of satisfaction. So that's something to ask yourself. And then I think another great question to ask when you're interviewing for positions is what are like what are potential career trajectories for me at this company or at this institution, and really like getting a better sense of like, does this employer want to hire me for the long haul? And there are a lot of opportunities for growth, personal growth, career growth, getting experience in management eventually, if that's something you're interested in or whatever. Or is this the type of employer where they want to hire new grads and they want them to work there for a couple of years and then they want to kick them off to the next opportunity? And if that's something that you're like, yeah, I do want a couple of years of opportunity at this place, and then I'm happy to move along. Or if you really are looking to find more of like a position that you could see yourself working and growing in over time and over a longer period of time. So just thinking about like what your personal thoughts are for and desires are for career trajectory, and then if that matches up with the employers that are interviewing you.
I was about to chime in and then I keep getting interrupted here, as you can see in the background. Michael, correct me if I'm wrong, but I feel like from my time advising and working with SuccessWorks, isn't it the case? I mean, so I'm 42. So when I was, an undergrad, there was still this sort of notion where like you get out of college and you get a job and you stay there for a long time. But is it the case that now, like, that's not typical, right? We're bouncing around a lot. This is my third job in 3 years. I think I'm atypical for my age, but we're bouncing around a bit more, right? So I wonder I'm asking the students, like, I wonder if those same considerations that we had when we were graduating are like at the forefront for you. Like, do you want a position where you want to be there for 10, 15, 20 years? Or is it more like, I'm going to use this as a shorter opportunity, learn what I can, and maybe I'll go a completely different direction. Maybe I'll just grow in my career. But I've asked a lot of questions. I'm sorry.
Yeah, I think that even for me, when I was graduating undergrad, a lot of this was when I knew I wanted to go to grad school, but hadn't locked it in yet. A lot of places were offering 2-year contracts and 3-year contracts. And it was very evident that those places were definitely only trying to have undergrad degree holders stay for maybe just 2 or 3 years. And then they would definitely make more of an effort to keep master's students, master's graduates or PhD graduates for a longer time. And I do think that a lot of career opportunities and jobs right now kind of have that going on, where people are bouncing around quite a bit. But we do have another question, and it's about experience. So experience is important for resumes and even applying to jobs. How could we, as undergrad students, have experience in the mental health field, given that requirements for internships is they're already asking for experience, basically?
I think going down the nonprofit organization route is a great option. You can actually get paid for many of these positions. So they're not internships, they're just part-time jobs. And you'll get to work with individuals from a variety of backgrounds, and can build lasting relationships that really positively impact other people's lives. And I got a lot out of that. And I think that was, yeah, definitely just a super valuable experience. Outside of like actual clinical experience working for a nonprofit or getting some type of internship, although I will say, like, for the nonprofits, I was not asked or expected to have previous experience. I don't know if anything has changed since like 2008 or 9 when I got that job. But that was not an expectation at that point in time. So again, definitely check out local opportunities for that. But also there are sometimes like research labs that you can become a part of, where you can also get a little bit of clinical experience. Like some of the psychology research labs that exist, you get to administer surveys or do some sort, I think there's like video surveys that you can do, and you can work with individuals with autism and schizophrenia, bipolar disease, other conditions in that regard. And then you can get experience with research and understanding like qualitative versus quantitative experiments, and build your resume that way as well.
I'm in here. Sometimes I have really strong feelings about the word internship, right? Because is it a privileged thing that really, folks who don't have to work and can afford to have all these opportunities that you need to get the internship end up getting, and then the folks who don't have the time or resources to do all these extra added steps to get the internships don't. So maybe Success Works wouldn't like this, but what exactly is an internship? You can call a lot of things an internship, right? It doesn't have to just be like, here's an application for an internship. You can call a job, and I mean, I don't want anyone to lie on a resume. That's not good. You can get into trouble there. But consider what an internship actually is. Like a paid position, you might get more experience at a paid position than an internship, right? So paid positions are a way to go. Building off what Hannah said, like lots of research opportunities on campus, like the psychology department, the Weissman, UW Hospital, like Children's Hospital. I would think that some of those could be paid as well, and you're also getting direct clinical experience. And then a lot of the nonprofits in the Madison area, the ones that focus on maybe child welfare, like Safe Harbor is one that I know I volunteered to do. I mean, I had zero mental health experience, and they let me co-facilitate a group for survivors of sexual abuse. I mean, I had to pass a background check, I guess. But I would think lots of the local nonprofits, whether that's DACE, which is Domestic Abuse Intervention Services, or Safe Harbor, or I'm trying to think where, but lots of local nonprofits might do groups or do outreach with folks, and would be so happy and thrilled to have volunteers. And you can count that as internship or an experience anyway, if we're not going to put air quotes internship around it. So think creatively.
Thanks for answering that. Another question, Amy, you kind of talked about this, but the question is, how much flexibility do you have in terms of dress and work hours and vacation?
I think this will vary extremely widely depending on what type of career path you take, and then the actual job or position that you end up at in the company that you work for. I work for a biotech company out from the Bay Area, so we have unlimited vacation. Unlimited, because actually research shows that companies that have unlimited vacation policies, individuals tend to take less vacation than if you have like a use it or lose it set number of days. So take that with a grain of salt, but there is that flexibility for sure. I used to work from the San Francisco office, and then I moved to Denver and worked remote there for 5 years. And I just moved to Portland a couple months ago, and I'm working remotely from here now. So there's a lot of flexibility in terms of like I could pick up and live wherever I want, at least in the United States. But I think even Europe I could do if I wanted. So that's really nice, and no dress code other than like not wearing anything that's like obscene in some way when you have Zoom calls. So yeah, there can be a lot of flexibility, but I think that there is less flexibility if you're working like potentially for the state, or if you're working for like University of Wisconsin and you're working in an office. There's probably like there are more set like vacation guidelines that you're not gonna be able to get around. I feel like UW is pretty lax in terms of having to like dress up for work, but for certain positions and certain fields, like if you do public policy and you're working like with lawyers, you might have to get more dressed up compared to other types of positions. So it really all depends. But I think these are great questions to also ask potential employers if that's something that you're like, I need this many vacation days, or I really want to be able to work remotely at least 3 days a week, or I really don't ever want to have to wear a suit or a blazer, whatever women have to wear. Those are great questions to bring up to employers.
Yeah, and in my experience, so I've been with the state for my time at the university counted as time with the state. So I have a whole bunch of vacation that I'm never going to use. I think I get like 5 weeks of vacation each year that I'm don't know where I'd go. I don't ever use it all. And retirement is another thing that if you work for state government or local government, that it's a perk that I didn't think much about when I was in my 20s, but now in my 40s I'm thinking more about it. And then in my experience, in my brief nonprofit experience, the vacation wasn't great and the retirement wasn't great until you'd been there a little bit longer. But the perks were that I had a really flexible position where I could kind of come in when I wanted and create the position that I wanted it to be. Where state government, you have sort of a position description with a bulleted list of things that you may or may not do in your job. But I have found, the field of public health has had great people in whatever setting I'm in. So the people make it a perk as well. It's not a field you go into because you're going to, become a millionaire quickly, right? It's a field that you go into because you want to help. So typically helping fields don't make as much money, sadly. But maybe they do. I might be wrong, Michael, but maybe there's a trend I don't know about.
Thank you. So we're almost at the end of our time here, but we do have one final question. And that is, what is one final piece of advice that you would give to students who are hoping to start or are continuing their journey in the public health field?
I think you all are already doing it. You're here learning more about it, right? And you're taking the time out of your days and schedules to talk to folks who are in the field. I think that's the number one piece of advice I'd give to anyone interested in any field, is to talk to folks who are doing the work about their experience, the advice they give, how they got there, and kind of learn from others who have kind of hacked that path for you already.
Yeah. And just not giving up, not getting discouraged when, again, like, life takes you on a path that's different, whether that's slightly or completely different than what you're currently thinking that the trajectory is going to be. Um, and yeah, just continuing to, like, check in with yourself. Like, am I feeling, do I feel passionate about my career choice? Am I excited about what I'm doing? Um, and then going from there, I really think that having that, like, internal passion and drive is so, so important, and something that, like, was very uncommon in our parents' generation and parents' generation, but something that is becoming more common now, as we have more opportunities afforded to us. So definitely something to consider. Like, will this be a career that you'll be interested in for the long haul? Will you be okay with changing if you don't feel interested in a career path after a few years? And yeah, just taking it day by day.